Imagine a child who avoids eye contact, flaps their hands when excited, or becomes overwhelmed by loud noises. Another child might have an extraordinary memory, reciting entire movie scripts or solving complex puzzles far beyond their age. Yet another struggles to understand sarcasm, taking everything literally. These are just a few of the countless ways autism spectrum disorder presents itself. Autism is not a single condition, but a broad spectrum, meaning that no two individuals experience it in the same way. ASD is a neurodevelopmental disorder that affects how a person interacts with others, communicates, and experiences the world. The term spectrum is important because autism ranges from individuals who need minimal support to those who require significant assistance in daily life. According to the Centers for Disease Control and Prevention, about 1 in 36 children in the U.S. is diagnosed with autism, making it one of the most prevalent developmental disorders today. Historically, autism was misunderstood. The term autism was first used in 1911 by psychiatrist Eugen Bleuler, but it was not until Leo Kanner's research in 1943 that autism was recognized as a distinct condition. Kanner described children who exhibited extreme aloneness and had difficulty forming relationships. Around the same time, Hans Asperger described a group of children with similar traits but stronger language skills, what would later be known as Asperger's syndrome, a diagnosis now merged into the broader ASD category. So, what defines autism? The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, outlines 2 core characteristics: difficulties in social communication and interaction, struggling to understand facial expressions, tone of voice, or social norms, difficulty forming and maintaining relationships, literal thinking and challenges with figurative language or sarcasm, restricted and repetitive behaviors, interests, or activities, repetitive movements, for example, rocking, hand flapping, intense focus on specific topics, for example, memorizing train schedules, collecting facts about space, sensory sensitivities, for example, discomfort with certain textures, strong reactions to loud noises. One of the most controversial myths about autism is that it's caused by vaccines, a claim that originated from a fraudulent study in 1998 by Andrew Wakefield. This study has been completely debunked, yet vaccine fears persist, despite overwhelming scientific evidence showing no link between vaccines and autism. The exact causes of ASD are still being explored, but research suggests a strong genetic component. Studies have found that if one identical twin has autism, the other twin has up to a 90% chance of also being diagnosed. Additionally, brain imaging studies show that autistic individuals often have differences in brain structure and connectivity, particularly in areas responsible for social communication and sensory processing. Diagnosing autism requires a comprehensive assessment, as there is no single medical test for ASD. The Autism Diagnostic Observation Schedule is one of the most widely used tools, involving structured social interactions and play-based activities to assess communication and behavior. The Modified Checklist for Autism in Toddlers is a common screening tool for younger children, helping parents and doctors identify early signs. Early diagnosis is crucial because early intervention leads to better outcomes. One of the most effective interventions is applied behavior analysis, which focuses on reinforcing positive behaviors and improving communication and social skills. However, ABA has been controversial in some autism communities, with critics arguing that it focuses too much on making autistic children fit in rather than supporting their natural way of experiencing the world. Other interventions include speech therapy, to help with language and communication, occupational therapy, to improve sensory processing and daily skills, and social skills training, to help children navigate friendships and interactions. Many children with autism also benefit from alternative communication methods, such as picture exchange communication systems or augmentative and alternative communication devices. A well-known case that brought autism into the public eye is Temple Grandin, an autistic professor of animal science and a leading advocate for neurodiversity. She has spoken extensively about how autism gives her a unique way of thinking, stating, "The world needs different kinds of minds to work together." Her work has been instrumental in changing the perception of autism from a disorder that needs to be fixed to a different way of experiencing the world. The idea of neurodiversity, popularized by sociologist Judy Singer, challenges the notion that autism is purely a disability. Instead, it sees autism as a natural variation in human cognition, emphasizing that autistic individuals have strengths such as attention to detail, deep focus, and innovative thinking that should be celebrated. That being said, many autistic individuals and their families face real challenges, especially when it comes to education, employment, and social inclusion. Over 85% of autistic adults are unemployed or underemployed, not because they lack skills, but because the workplace often fails to accommodate their needs. Many companies are now recognizing the value of neurodiverse employees, with major firms like Microsoft, SAP, and Ernst & Young launching autism hiring programs that focus on strengths like pattern recognition and problem solving. As society becomes more aware of autism, the conversation is shifting from how do we fix this to how do we support autistic individuals in reaching their full potential? Understanding, early intervention, and inclusion are key, not just for autistic children, but for a world that benefits from diverse minds and perspectives.